Welcome to the website of MRA, the Medical Acupuncture Research Institute of America. MRA is an institution of higher learning devoted to the education, training, and practice of MRA, Meridian Regulatory Acupuncture. MRA is the official website for information about MRA and the MRA system of therapy. If you're a physician, patient, or concerned family member looking for facts and information about scientific acupuncture and natural healing, or simply seeking a safe and effective way to relieve chronic pain and disease, you'll find this site very helpful. MRA is Smart Medicine, a highly refined, scientifically advanced system of acupuncture therapy used in the treatment of severe chronic pain disorders and major ailments. MRA therapy works to relieve low back pain, migraine headache, arthritic pain, sports pain injury, fibromyalgia, neuropathy, carpal tunnel syndrome, allergy, autism, ADHD, Alzheimer's disease, impotence, psychiatric and stress-related disorders, and many other conditions that are largely unresponsive to conventional medicine. MRA does not eliminate or replace the need for surgery when required. However, it can be a useful tool to both the surgeon and patient. MRA can help relieve post-operative pain and swelling and speed up the healing process for early recovery. As you search this site, learn more about the history of MRA and explore the many therapeutic benefits of Meridian Regulatory Acupuncture, you'll discover real hope, real science, and real answers. The kind of answers that can transform the lives of patients, caregivers, and even physicians. MRA was developed in the early 1970s by Lupo T. Carlotta, a medical doctor born in the Philippines. Carlotta became one of the first practitioners of acupuncture in the United States after it was publicly introduced in 1972 as a result of a presidential visit to China. Carlotta recognized the potential value of acupuncture for physicians and patients, but he also saw its limitations. Through the trained eyes of a Western physician, Dr. Carlotta carefully examined the strengths and weaknesses of traditional acupuncture, noting, in addition to its good attributes, one major hurdle, a hurdle so large that it could easily keep acupuncture's true potential from being realized. The problem was simply this: traditional acupuncture was, and still is, presented as a healing art, a practice considered by many to be steeped in mysticism and philosophy, not science. What difference does that make? To a layperson, perhaps not much. But to a highly trained, scientifically minded doctor, the difference between an ancient practice that presents itself as a healing art compared to a modern medical therapy clearly based on science is the difference between night and day. It was this scientific credibility gap that Dr. Carlotta knew had to be bridged for acupuncture to be accepted and embraced by Western doctors and their patients. Confronted by this challenge, Carlotta formulated the breakthrough quantum theory of acupuncture, a pristine presentation explaining for the first time how and why acupuncture works from a scientific perspective. With this detailed scientific working model as his foundation, Carlotta then developed MRA, Meridian Regulatory Acupuncture, a medically sound, scientifically advanced system of acupuncture therapy that has been embraced, recommended, and used by hundreds of Western-trained physicians since 1973. In 1976, Dr. Carlotta gained recognition among members of the global acupuncture community when he presented the revolutionary quantum theory of acupuncture at the International Acupuncture Society Convention in Taipei, Taiwan. Dr. Carlotta's contributions to the science and practice of acupuncture were so highly regarded that in 1983 he became the first Western physician invited to mainland China to give a series of lectures on MRA theory, science, and practice in the medical centers of Beijing, Nanjing, and Shanghai. In developing MRA, Dr. Carlotta's goal was to simplify the practice of acupuncture for Western physicians and establish a clear scientific basis for its use and effectiveness in a way Western-trained physicians could understand and accept. In the MRA system of therapy, a single short, hair-thin needle, guided by a mild electrical impulse, replaces the multiple needles of traditional acupuncture. This safe and much less invasive approach is made possible by a microsensitive device that tells the doctor precisely where and how much treatment is needed. With MRA, the era of modern scientific acupuncture was born. In creating the MRA system of therapy, Dr. Carlotta ushered in a major paradigm shift in how acupuncture is perceived and practiced by Western physicians in America and other countries. MRA has gained the respect and acceptance of doctors, patients, and family members looking for a safe, natural, and effective way to manage severe chronic pain and disease. MRA works. It has shown its healing wonders by relieving many debilitating and hard-to-treat disorders, including conditions that do not respond well to conventional medicine. After nearly 40 years in the hands of independent practitioners, Meridian Regulatory Acupuncture is considered the most advanced system of medical acupuncture in the world. If you're a physician, integrating the MRA system of therapy into your medical practice can be a highly rewarding experience. Certified MRA education and training is available. With personal instruction from Dr. Carlotta, we'll help you get started in this newly rediscovered branch of medicine. For more information, call 901-821-8595. We hope this information has been helpful. If you're an individual with a medical concern and need to make an appointment to see a doctor at the MRA clinic in Memphis, or if you're a physician and want to refer a patient for treatment, call 901-821-8595. On behalf of all of us here at the Medical Acupuncture Research Institute of America, thank you for your interest in MRA, Meridian Regulatory Acupuncture.